now we can shift to the last speaker, which is Professor Gianluca Neglia, and who is also a veterinarian and has a PhD in animal breeding science, specialist in animal nutrition, and is now a full professor in the Department of Veterinary Medicine and Animal Production at the University of Federico II in Naples. He's also coordinator in of the master degree in precision livestock farming. His scientific interests are focused on the breeding technique of livestock, with particular regards to ruminants, buffalo, bovine, and goat, and as well as on the application of the main reproductive biotechnology. Luca, the floor is yours. We cannot see.
Thank you very much. Thank you very much, Antonella. Thank you very much to everybody. And thank you, obviously, for inviting.
We cannot see you.
Did you hear me?
No. Is your webcam on?
No, I'm on. I can see my screen.
We cannot. Try to... oh, ok, Giovanna lo può vedere. Anche noi. Oh, ok, now. Okay, now you're on.
Is it okay?
Yeah, okay.
Okay.
The floor is yours. Thank you.
Okay. Thank you to everybody. Thank you, obviously, for inviting me to give this presentation. I just share my screen. Okay. Can you see it?
Yes, perfectly. Yes.
Okay. Okay. We will talk today about artificial insemination, the application of artificial insemination in buffalo. And as Angela said before, the management of reproductive activity is particularly important because without reproduction, we have not the chance to have production. And just to have a look, if we think that if I am able to increase the fertility and to have a higher technical and sanitary management of my herd, I will be able to have more milk yield for year, a higher number of calves for genetics improvement. I can reduce the cost of milk, and obviously I can have the chance to have a higher culling rate. One of the main parameters that is used for the management of reproduction is the intercalving period. We know that after calving we have about 30 days during which there is the uterine involution, and after that we would have the so-called days open, the interval between the calving and the conception, and then the subsequent pregnancy. So if we want to have an intercalving period of 12 months that is considered ideal, it means that in most Taurus, considering the pregnancy of 280 days, we would have about 85 days of service period. In buffalo, it is quite more complicated because we have one more month of gestation. So it means that the service period is about 60 days. And the intercalving period is particularly important. If we look at this picture, you can see that a buffalo that produces about 2,800 kilograms, it is it has a real production of 2,800 kilograms if the intercalving period is 365 days. But if this intercalving is about 600 days, the same production has to be diluted in 2 years. So it's about 1,800 kilograms. So all this consideration led to the importance of manage the reproduction to increase the reproductive efficiency of the herd. And as Angela and Vittoria said before, we have a lot of problems to apply to manage the reproduction in buffalo due to the increased herd size that we observed, in particular in Italy, the increased milk yield, and different housing system. Together, also, we have some characteristics that are particularly unuseful for the application of some biotechnologies, such as artificial insemination, that are the low estrus behavior that we have in buffalo, together with the biostimulation effect of the male, the variable duration of the cycle and the low duration of the estrus. There is some peculiarities in the estrus cycle of buffalo, such as the duration of the cycle that is mainly 22 days, but can vary from 11 to 37 days, high incidence of silent hits, high variability in estrus duration, and so on. And high incidence of anaestrus, as Angela said before, because we know that buffalo is seasonal, so we need to select the animals that are less sensible to the photoperiod. This is mainly due to the reproductive seasonality of the species, as Angela said before, due to the origin of the buffalo. And this is particularly important in Italy because, as Angela said, we have the problem that the market requirement for milk is particular during the spring-summer period. So we need to concentrate the calving from completely out of the breeding season of the animals. The reproductive seasonality has causes several problems in buffalo, such as embryonic mortality, reduced oocyte quality, CL functionality, alteration in the oviductal fluid, and the phenomenon of anaestrus. Some of these problems can be partially solved by using the synchronization treatments, ultrasound, and artificial insemination. In particular, for the artificial insemination, we can use the ultrasound or some pharmacological treatments. The ultrasound can be useful, for example, for an early pregnancy diagnosis in buffalo and for ovarian activity monitoring, for evaluating, for example, corpus luteum or follicles and something like that. Estrus synchronization is a pharmaceutical management of reproduction that can be obtained by the administration of several molecules. The advantage of synchronization treatments are different. We can have an improves the efficiency of heat detection, reduce the time required for estrus detection, and in case of synchronization of ovulation, we don't need to evaluate the estrus detection. The estrus cycles are more regular. It is possible to control the first service postpartum. We can be able to reduce the calving intervals, and so on. Several hormones can be used for synchronizing the estrus, and in particular, they can act on several stages of the estrus cycle, on the follicular energy synchronization, like GnRH or HCG, on corpus luteum regression, like prostaglandin or progesterone, or on the control of ovulation, like GnRH, LH, HCG. And there is also another hormone that I put just here, that is the HCG or PMSG. That is a particular hormone, very interesting, because it has several actions, and it can act both on follicular emergency synchronization and on the control of ovulation. In particular, for synchronizing the estrus of the animals, we can act in two ways: manipulating the lifespan of the corpus luteum and manipulate the growth of follicles and the timing of ovulation. This is what normally occurs on the ovary. We know that we have several follicular waves on the ovaries, and when a follicle reaches a particular dimension that is about 7.2 millimeters in buffalo, it acquires receptors for LH. And this phenomenon is called deviation. After deviation, we can have the regression of the dominant follicle or the dominance of the follicle and then the ovulation. This is the concept on which work some hormones like GnRH, for example, that is able to reduce the inhibin and estradiol levels and to increase the FSH levels, allowing the recruitment of a new follicular waves. In this way, we can have the ovulation of the follicle, and a new follicular wave can start. Differently, the estradiol plus progesterone can act by reducing the levels of LH and FSH, so causing follicular atresia. And after follicular atresia, we can have again the start of a new follicular wave. The other way that we have to synchronize the estrous cycle is to act on the corpus luteum regression. We know that the corpus luteum, as Vittoria said before, is a particular, a very interesting hormone that is present on the ovary. And normally, its regression is due to the release of prostaglandin F2 alpha from the endometrium that is able to induce the release of endothelin 1 and angiotensin 2 to reduce the blood flow to the corpus luteum. When we can use prostaglandins in this sense, exogenous prostaglandins, obviously, and that can have a different action. I mean, usually prostaglandins are very useful when they are used from day 5 to day 17 of the estrous cycle. Otherwise, they have no action when they are administered from day 1 to day 4, from day 18 to day 21, because in this case, we have or a corpus luteum that is not responsive to prostaglandin, or a corpus luteum that is already regressed. And it is interesting to note that the time to response depends on the stage of the follicular weight. In fact, if we consider that after prostaglandin administration, we usually have the estrus at about 60 hours, but there is a variability from 47 to 70 hours, depending from the stage of the estrous cycle when the prostaglandin is administered. Another hormone that can be used is the progesterone that is produced normally from the corpus luteum, and basically the blood progesterone levels are the results of a process that include progesterone synthesis and progesterone metabolism. Progesterone synthesis is carried out in the corpus luteum through the conversion of cholesterol, and in this process are particularly important the roles of star, CYP11A1, and the dehydrogenase enzyme. On the contrary, P4 metabolism is carried out in the liver, and in this case is particularly important the aldoreductase step and some conjugation pathway that are catalyzed by cytochrome P450. As I said before, the progesterone levels are the results of a balance between P4 synthesis and P4 metabolism. But we can use also exogenous progesterone to synchronize the estrous cycle, as we will see in a few minutes. The other hormone that we can use in Italy is the HCG. HCG is produced from the endometrial caps of the pregnant male, and as I said before, he has an LH and FSH activities. In particular, it is composed from two subunits, the alpha and beta subunit, and in particular, the beta subunit is characterized by high content of sialic acid. This is the reason because HCG has a very long half-life in cattle, and it is particular because he has a dose-dependent action. We can use it for both superovulation and embryo transfer, or for synchronization of synchronization treatments, obviously in different dosages. Okay, and the main action that HCG can have can be seen in the increase of estradiol levels, for example, as you can see in this slide, 750 international unit of HCG are able to increase the estradiol levels in 48 hours. No HCG increase the same estradiol levels in 144 hours. And can act also on progesterone when administered on day 7 by acting on the large luteal cells, increase the progesterone levels. So several factors can influence the estrus synchronization, and the different hormones that I talked before can be combined among them in different synchronization treatments. Several protocols have been developed in buffalo. I want just to give you a look of the main protocols that are utilized. Probably the main protocol is the OVSync type program and the co-sync program. The OVSync is characterized by the injection of GnRH on day 0, prostaglandin on day 7, and GnRH on day 9, with artificial insemination carried out on day 10 at about 16 hours from the last GnRH and 60 hours from the prostaglandin. Another possibility is to perform the second injection of GnRH together with the artificial insemination. This protocol is called the co-sync program, and in this case we have the advantage of taking the animals one time less. It's the methods probably largely applied in buffalo, very cheap and simple. Obviously, it gives the best results in cyclic subjects, because in this case we have the ovulation of the follicle, as I showed you before, by the first GnRH. After that, the regression of the corpus luteum by the prostaglandin, and the synchronization of ovulation through the second GnRH. So in non-cyclic animals, the efficiency of OVSync type program is quite low. This is the best protocol that is used in anaestrus animal. In this case, we use a vaginal implant of progesterone. In Italy, we have not the chance to use injectable progesterone. The only chance that we have is to use the vaginal implant. About 15 years ago, the drugs that we have were also associated with estradiol. Actually, there is no estradiol, so we need to perform a GnRH before starting the protocol. After that, the vaginal implant can remain for 10 days, and after the removal of the implant, we can carry out an injection of PMSG or HCG and prostaglandin. In case, we can apply also a GnRH 48 hours after the removal of the implant to synchronize the ovulation. This is the more expensive compared to the OVSync type program, but is the elective protocol that can be used for acyclic buffaloes. Another treatment, very simple, is the treatment by double prostaglandins or by double prostaglandins plus GnRH. Also, in this case, the treatment consists in two injections, 12 days apart, from 9 to 12 days apart, with artificial insemination that can be performed 3 and 4 days after the second prostaglandins, or in case we apply in a further an injection of GnRH to synchronize the ovulation, just one insemination on day 15. Also, in this case, the best results is in cyclic subjects, and this treatment can be particularly useful in AFERs. There is also the possibility to associate the OVSync type program plus with the treatment by progesterone. It is a treatment useful also in acyclic subjects, but it's very expensive, although the vaginal implant can be also reutilized. One of the last treatments that has been developed for buffalo, and that comes from cattle, is the the GCG protocol or double OVSync type program. It consists in 2 OVSync program, approximately 1 week apart. Well, it is very, very interesting, and the pregnancy rate can be about 55-60%. The problem is that is very expensive and very long. I mean, for a double OVSync, for example, I need about 1 month for synchronizing the animals. So it's very difficult to apply in practice. Just to have a look of what we are doing by this protocol of synchronization. This is the ovosync type program that we talked before, and you can see that the after the second GnRH, about 90% of the ovulation are concentrated between 26 and 38 hours after the second GnRH. In one of the first studies that we used the ovosync program and compared it with progesterone, with treatment by progesterone, we observed a good pregnancy rate, in particular in cyclic subjects, but progesterone was able to guarantee a resumption of the ovarian cyclicity in 100% of the animals. The ovosync program has been also improved subsequently through different techniques. In this trial, for example, we applied the utilization of prostaglandin at the time of artificial insemination, and we obtained about 16% more pregnancy rate, with an increase of progesterone levels on about day 11 after tie. Obviously, type program can be successfully used also for sexed semen. We used it in previous trial in buffaloes compared with conventional semen, and we obtained a similar pregnancy rate. And we used also in AFERs with similar results. The sexed semen in particular can be very, very important in buffalo because according to these studies, we had similar pregnancy rate compared to conventional counterpart, but we have the chance to noticeably accelerating the genetic gain because we are able to increase the voluntary culling rate. We can also reduce the problem at calving because the females are usually smaller than males. We can increase the herd size. We can reduce the problem due to the breed of male calves, and we have obviously some economical advantage. And just to give you a look of what we are doing now, because we are carrying out a project together with ANASB, and in this case we utilize about 4,000 doses of sexed semen for Italian buffalo breeders. As I told you before, for the AFERs, one of the main treatments that that can be used is the double prostaglandins. Double prostaglandins. In this trial, we compared it with the ovosync type program, and in front of a similar synchronization rate that we had with the two treatments, we observed a higher live body weight in the animals that respond to the treatments of synchronization, in particular in animals treated by double prostaglandins. No differences were observed in ovulated and not ovulated animals in animals treated by ovosync. But interestingly, when we observed the pregnancy rate at 90 days, we had about 10% pregnancy rate more in double prostaglandins treated animals, because probably in this case we were only the very cyclic animals were selected by double prostaglandin. With ovosync, it is possible that also animals that had just a follicle in the deviation phase, also if they were in the peripuberal phase, were able to respond to the treatment. So in this case, in particular for the AFERs, the suggestion is to consider very, very important the live body weight of the animals rather than the age. And according to all these trials, we applied also several treatments of resynchronization. This is an example of a standard procedure that is applied in several buffalo farms that consider a resynchronization by using the ovosync type program. In this case, the first protocol starts on day 37, 40 days after calving. After 10 days, there is the first artificial insemination, and 20 days later, there is the administration of a GnRH to all the animals. This GnRH has a double action to reduce the embryonic mortality, and from the other side, in non-pregnant animals, it represents the first GnRH of a new ovsing treatments. So in non-pregnant, after the ultrasound examination, the animals can be re-inseminated on day 76, and again can be re-inseminated on day 106. We applied this protocol till 7 times. Which were the results? Well, which were the results? Well, we observed firstly a little bit lower pregnancy rate during the January-March period, the transitional period of the buffaloes, and a similar pregnancy rate throughout the year. But the most interesting result is that through the first 3 artificial insemination, we had more than 19% of pregnancy rate. It means that if an animal is not pregnant after 3 artificial insemination, probably, well, of course, if it is an animal of high genetic merit, we can try to re-inseminate again the animals, but otherwise, probably is better to cull it. And interestingly, we have also a reducing of the intercalving period compared to what we obtained in natural mounting. The similar resynchronization protocols can be applied also in heifers. In this trial, we compared the synchronization through the resynchronization treatments through ovsync compared to that obtained by progesterone. And the interesting thing is that throughout the year, also if the heifers, as Angela said before, are less sensible to the photoperiod, well, during the period of increasing daylight length, we observed a higher pregnancy rate in progesterone-treated animals. And also in this case, about 90% of the heifers were pregnant after the first 3 artificial insemination. However, one of the question that we try to give an answer is that about 50% of the animals that are normally synchronized can be excluded because they have not corpus luteum functionality or have low dimensions of follicles. But in other cases, about 85–90% of animals are inseminated, but pregnancy rate is rarely higher than 50–55%. So we try to individuate which were the factors that can be considered for increasing the efficiency of ovsync type program. And so we treat some animals, and we evaluated the response to the first GnRH, observing by ultrasound the ovulation or not of the animals, the response to prostaglandin, observed luteolysis or not, and to the second GnRH. And we carried out also some blood sampling on the day of starting the protocol, on the day of artificial insemination, and of day 10 after artificial insemination. What we observed? Well, about 60% of the animals ovulated after the first GnRH. It's normal. It's what normally occurred also in dairy cattle. When we observed the response to prostaglandin, the total response to prostaglandin is about 87%. But interestingly, about 99% of the animals that respond to the first GnRH respond also to prostaglandin, compared to about 60% of the animals that did not respond to the first GnRH. And the response to the second GnRH was also in this case similar. About 93% of the animals that respond to the first GnRH respond also to the second GnRH. Interestingly, the progesterone levels that we observed in the animals that respond to the first GnRH were higher at the start of the treatment and were higher 10 days after artificial insemination. What about the pregnancy rate? Well, about 60% at 27 days, reducing to 48% at 45 days for the phenomenon of embryonic mortality. But if we correlated this pregnancy rate to the response to the first GnRH, we can observe as all the animals that respond to the first GnRH has also a higher pregnancy rate. So probably and this was confirmed also by the logistic regression, the response to the first GnRH is one of the determining factor to increase the reproductive efficiency in this case, because the ovulation to the first GnRH can cause the new follicular wave and the formation of a young CL that can be receptive to the prostaglandins that are performed 7 days later. One of the last trial that we carried out is on the evaluation of the thermal stress of the animals treated, synchronized by progesterone. In this case, we performed the treatment by vaginal implant of progesterone, carried out an artificial insemination through synchronization of ovulation, and after that we start with the animals were put together with the bulls for natural mating. Ultrasound were performed about 15 days apart to evaluate the pregnancy rate also by natural mating. Which are the results? Well, after artificial insemination, we have about for 50%, so what normal occurs. But interestingly, in animals that were non-pregnant animals that were put with the bulls, within 3 cycle post-insemination, we had about 19% of pregnancy rate. And the influence of THI was definitely lower than that observed in dairy cattle. In a recent trial that we performed, we demonstrated that probably that buffalo is more sensible to low temperature rather than high temperature like dairy cattle. So at the conclusion, which is the best synchronization for of estrus for buffalo? Basically, the best treatments does not exist because the AI efficiency can be obtained considering several factors, such as the season of the year, the category of the animals, the metabolic status of the animals, and the synchronization treatments that is applied. Only if all these factors are considered, the efficiency of artificial insemination after synchronization of estrus is particularly high. And I think I can stop here. Thank you very much.
Thank you. Thank you, Gianluca. So thank you for the interesting presentation. I just want to tell you, all the participants, if you want to ask some questions, you can write it in the chat, and then we can try, or raise your hand as well as you can. So if you have some question for the speakers, we can. In the meantime that you think about it, let me, I just want to tell you that the first series of webinar is, the first 3 is concluded. Now we stop for the summer and we are back on September. And so let me share. So the last 3 topics we are going to come no? Oh. Aspetta, condividi, destra, no, no. E perché non me la prende? Okay. Well, so the last three topics are from production point of view. So we are from raw milk to dairy products, buffalo for meat production, and the last one is about the environment and sustainability of buffalo farming. But we will inform you as soon as we fix a date for September. So. Okay, so we can, if there are no answers, we can have Professor Borghese give the conclusion to this webinar, or?
Yes, I just. Oh. Just they thanks the speaker, are thanking the speaker for the presentation of today. Maybe the summer is approaching. Today we are not in not a lot like the previous one. Because of this, we are stopped, as Antonella said, and we will return with the other webinar in September. So I think that even if nobody has to ask some question, I give the floor to Professor Borghese for the conclusion.
My compliments to the speakers and to the people participating to the third webinar. I liked very much that Professor Neglia said, or he started with this comment, no reproduction, no production. Because this was a comment that I often said when in the year 1980, more than 40 years ago, finally, we convinced the Ministry of Agriculture to finance a big project on buffalo species, as finally the Ministry of Agriculture understood the importance of buffalo in the economy of the country. And I convinced them to apply a sub-project on reproduction. Because at that time, finally, we started to study the basic physiology of the reproduction in the buffalo with many subunits participating to the project. Federico II, University of Naples, with Professor Zigarelli and his staff. I like to remember when Campanile was very young, probably a student, and Professor Neglia, I don't know.
No, la media. Maybe he was he went to the high school.
Yes.
At that time.
And I like to remember Professor Seren, that was a big physiologist in Bologna University, and Professor Bertoni in Catholic University of Piacenza. And we started to apply artificial insemination at a fixed time after synchronization with hormonal treatment. I liked very much this webinar because I can look at the great progress in this field with young scientists as you, as the speaker now. And because this very important underlined that these are not only basic study, but this is the basic of the impact of the economy of buffalo in the market. Thank you very much.
Thank you.
Thank you very much.
Gianluca and Neglia. Thank you, Angela Salzano. Thank you for joining us in this webinar. And I thank all the participants from over the world as the other time. And have a nice summer. See you in September. Bye-bye. Thanks you again.
See you. Bye-bye. Thank you.